afternoon, and welcome to the Meaningful Use Attestation and PQRS Submission webinar. Melissa Ottinger will now begin.
Good afternoon. I wanted to thank everyone for joining the Lake Superior Quality Innovation Network call on preparing for Meaningful Use Attestation and PQRS submission. The Lake Superior Quality Innovation Network is made up of 3 quality improvement organizations: Stratus Health in Minnesota, MPRO in Michigan, and Medicare in Wisconsin. Together, we are working to improve health care for Medicare beneficiaries, share best practices, and maximize efficiencies. On the call today, we have Keisha Looper and Laura Sawyer from MPRO. Joining us to answer questions regarding the respective states is Marnie Anderson from Medistar in Wisconsin and Candy Hansen from Stratus Health in Minnesota. Welcome, ladies, and thank you for joining us. Before we get started, I want to mention that there will be time for questions and answers at the end of the session, but feel free to also use the chat box. Before you disconnect from today's call, be sure to fill out the evaluation. We really appreciate the feedback. The objectives for today's educational session will include obtaining a CMS EHR certification ID, submission of meaningful use measures, preparing for an audit, registering and understanding roles of the IACS account, and also EHR PQRS submission. Without further ado, I will now invite Keisha Looper to tell you all about prepping for meaningful use attestation. Keisha?
Thank you, Melissa, and thank you for inviting me, or should I say forcing me to speak today. I'd like to take some time to just mention that today's meaningful use material is going to solely focus on preparation for attestation and ensure that you're prepared in the event that you're chosen for a meaningful use audit. In addition, as Melissa had said, because we have callers from 3 different states, Minnesota, Wisconsin, and Michigan, we will only be covering the Medicare EHR incentive program and not the Medicaid for each individual state. So please feel free to contact your state's QIO for specific Medicaid EHR incentive program questions. Okay, so let's get started. So just a few things that we're going to discuss today and things that you need to be sure that you have all in order before you attest. First, you're going to need your NPES or NPPES, NPI, or your PACO's username and password, because they're all the same. Then we're going to discuss obtaining your 2014 EHR CMS certification ID. And if you're still waiting on your system upgrade to the 2014 version and you're utilizing the Flex rule this year, then you're still going to use your old 2011 EHR certification ID number from your previous years of attestation. And then next we're going to make sure that you have all your reports and screenshots saved in a folder that you can utilize in case of an audit as well. So once all these things are completed, then you'll be ready to attest. So first, let's get into how to obtain your username and password. So in the event that you or your provider have lost your login information that you'll need for attestation or just even to register, don't worry, the CMS External User Services Help Desk, the EUS Help Desk, will be able to provide you with the username and they'll be able to reset the password for you. So just a word to the wise though, if you're calling for a provider and your name is not listed, if you're calling on behalf of a provider and your name is not listed as an authorized entity under the provider's NPI number, then the EUS Help Desk will need to speak directly to the provider, so make sure that they are in the office or nearby when you're calling to get that reset. Okay, so the next item is to complete or obtain your CMS EHR certification ID number. For those of us in the business, we call this the Chapel website, and the address is found at the top of this slide. Once you've entered the Chapel website, you will come to this page where you will need to pick which edition year your EHR is. So if you have already upgraded to the 2014 version of your system, then you will go ahead and take the 2014 edition button. And if you're still not upgraded and you're utilizing the flexible for this year's attestation, then you would choose the 2011 edition. And lastly, if you upgraded in the middle of a reporting period, so you're using both 2011 and 2014 versions in the middle of your reporting period, then you're going to go ahead and pick that you're using a combination of your 2011 and 2014. So in this example, we went ahead and selected the 2014 edition. From here, you'll search your EHR product name or version name, and that's going to be in the middle gray box. Please be aware that if you put your EHR name and you just hit enter, like we mostly do on our keyboard, the chapel list will not populate any results that you are looking for. So you need to hit the search button. From there, it'll show you the results of all certified versions of your EHR system. There possibly could be several options for you to choose from. You need to pick the option that best fits your product. They may require you to look into the additional software that you have installed on your system. So some may have a different e-prescribing software or educational libraries. So you need to look into these specifically and choose which EHR best matches the one, or version best matches the one that you have in your practice. So once you found your exact system, you will select the product by adding it to the cart, much like you're shopping on Amazon, which I've been doing a lot lately. So once you add the product to the cart, it will direct you to a screen that will show you the details of the meaningful use functionalities of your system. The base criteria, the CQM domains, and the certified and the actual CQM that your system is certified to run. So please be careful with this part. When you report for meaningful use this year for your CQMs in 2014 with the 2014 system, you can only choose CQMs that are highlighted in blue. And I will show you once you hover over this section. I don't know if it's going to pop up. There it is. So once you hover over the ambulatory CQMs, this will pop up. The blue indicates that these CQMs have been certified by CMS to report for meaningful use. We sort of picked a bad example because this system was certified for all CQMs. However, that's not always going to be the case. So you really need to make sure that your system and the CQMs that it's certified for, that you're using those CQMs. If the system is not certified for particular ones, they will be grayed out, so they won't be highlighted in blue. So make sure that the CQMs that you picked for meaningful use are the ones that have been certified for by CMS. Okay, so now that you have verified your CQMs, you can go ahead and click the large Get Your CMS Certification ID number that is to the right. And voila, you have your big, ugly, scary EHR certification ID number. So we recommend that you put this page and put it in a folder, and you'll need this number when you actually go to attest for meaningful use. So the last step that you need to do to make sure that you are fully prepared to report for meaningful use is to make sure that you have a meaningful use folder. We encourage everyone to keep all of their meaningful use documents and reports in a binder. This binder should be able to house all of the reports and should be separated out by individual attestation years. So one for year one, a section for year two, and so on. If your folder is put together and complete with all of the suggestions within the next couple of slides, you'll be prepared for the attestation as well as if you were chosen for a meaningful use audit. So first thing that you're going to need will be the actual meaningful use reports that you generated from your EHR that you'll be using for attestation. Make sure the report on it has the provider name and the EHR from which it was generated from. If your meaningful use reports do not report out or print out with this information, then you'll need to take screenshots of the process of how you printed that meaningful use report. So we know that some systems, when you go to print out a report, will make you export it into an Excel spreadsheet. If you export it into an Excel spreadsheet and print it out from there, the auditors will not know or that's not proof enough to show that it came from your system. So you do need to make sure that when you have a meaningful use report, to verify your meaningful use measures that it has the provider's name and the EHR system that it was generated from. When you're printing this report, make sure you're printing out your core, your menu, and your CQM report with the correct reporting period date. If you're reporting CQMs for meaningful use attestation, then you use the same reporting period, that same 90-day reporting period, 2014. However, there may be some of you that are reporting CQMs with your PQRS submission, and if that's the case, then you're printing out your CQMs for a full reporting period or a full year. That may be a bit confusing, and if you have any questions on that, you can ask that at the end of the webinar. So next, you'll need to make sure that you have a copy of your completed or updated security risk assessment. And this needs to specifically identify any mitigation plans or steps that you plan to take to correct security inefficiencies that have been discovered during your security risk assessment. CMS actually has a creative interactive tool that they developed. You simply answer the questions, and then they provide you, or the tool will then provide you with a risk assessment report that you'll be able to print off and then create your own plans to work from. And this link will be shared with you at the end of my presentation on the resource slide. So in addition to keeping a copy of your meaningful use reports, or all your meaningful use reports, your security risk assessment, you're also going to need to keep a copy of your screenshots that prove that certain functionalities are turned on and are working in the EHR during your reporting period. So for example, taking a screenshot of your drug-to-drug and drug allergy interaction warnings, also having a screenshot of all of your clinical decision support alerts, and a screenshot of your drug formulary working as the prescription is being prescribed. Make sure that these are all done on test patients, or if it is done on a real patient, that you go ahead and block out any patient identifying information. And then last, when you create that patient list by specific condition, you also want to keep a copy of that within your folder. When you're taking these screenshots, it is advised that, make sure that you're keeping a date of when these screenshots were taken. For the auditors, when they go to audit, they're going to look to make sure that these screenshots were taken during the EHR reporting period that you attested to. So if you keep all of these things in a binder or folder in a safe place, and you know where it's at, and you don't lose it, then you will be very prepared to attest and to able to provide information if you are chosen for an audit. So even better, when you have all the criteria completed, you have your login information, you have your EHR certification ID number, and you have all of your reports and screenshots organized, then you're going to be ready to attest. So this hopefully is just a refresher for most of you. The registration and attestation system can be found at https://ehrrencentv.cms.gov, and the website is up at the top of this slide. And just as a refresher, you will have to go through some CMS literature before you actually get to the login screen. So follow the continue buttons and follow directions in order to get to the actual login page. So this will be where you're going to enter in that user ID, which is either your MPES, your MPI, or PACOs. Remember, they're all the same username and password. And if you are not the provider and you are attesting on behalf of a provider or have multiple providers, you are strongly encouraged to set up your own username and password and have the providers sign over authorization to you in order to attest your providers. This is something that is a little bit cumbersome, so we have provided the link here down at the bottom. You can go through the CMS website to get to a user guide for that process of signing over multiple providers. It's extremely helpful if you have multiple providers to do it this way. This way you have access to all of your provider information and meaningful use information all in one login. And this can be a bit cumbersome, like I said, so if you need help, contact your QIO. So once you've successfully logged in you will come to a screen with all the tabs at the top. If this is the provider's first time attesting, you must register first. It is also a good idea to review registration information and make sure that everything is still up to date. The registration information, such as the office address and the email address that is collected in the registration tab, is what is used to contact you in case you are audited. So it is important to make sure that you keep this information up to date. So we do suggest, even if you've attested before, go back into registration and make sure that everything is still up to date. So once you've completed and reviewed your registration, you may go ahead and select the Attestation tab at the top, or you can even use the Attestation button on the blue arrow in the center of the page. Either one will get you to the attestation question. From there, you answer the meeting to use questions according to the meeting to use reports that you pulled from your system. Now, we're not going to go through any more of the attestation process just because the website does a pretty good job of walking you through the meeting to use questions. But just a few reminders. In order for you to successfully attest for meeting to use, you must meet all of the 4 measure objectives, 5 menu objectives, and report on 9 CQMs across 3 different domains for this year. If you require assistance, please do not hesitate. Like I said, your respective states. So the QIO Michigan is Enpro, the QIO for Minnesota is Stratus Health, and contact Medistar in Wisconsin if you need assistance. Okay, so now on to the big scary audit portion of this. In the event that you are or your provider is chosen for an audit, you will receive a letter via that email that you chose in registration and attestation system. They will then also mail you one to the office address that is listed under registration. That is why it is very important to review your registration every year. You will have approximately 2 weeks to compile all of your meaningful use information and return it to Figliozzi & Company. If you have kept all of your meaningful use information in a folder as suggested, you will have everything ready, and you shouldn't have any problems. So just to go into a little bit more detail of what this audit is going to entail, accompanied with the email will be a document that's going to ask for particular information regarding your EHR. You'll need to provide proof that you actually possess the EHR that you claim to have when you listed your EHR certification ID number. And you need to provide, to prove this, you can provide licensing agreements or invoices of your upgrade, anything that verifies the physician or the practice actually has that system. They're also going to ask how many offices or outpatient settings does the provider see patients at that use EHR technology. Remember, meaningful use is by provider and not practice, so if the provider sees patients in multiple locations, then those need to be included in your meaningful use numbers that you report during attestation. This can become quite difficult, so we encourage you once again to contact your QIO or Regional Extension Center for assistance with this part of meaningful use. The audit is also going to ask about how you store medical records, meaning is all of your information stored in your EHR, or is some information withheld and you're keeping it still in paper charts. They're looking to make sure that you have at least 80% of your medical records from your reporting period are maintained in your EHR. So from there, you'll list all the meaningful use documentation that you want to provide to them. Give them only what they want. Nothing more and nothing less. Provide the report from your EHR that you use during attestation that represents your numbers for your core menu and CQM, and then proof of your yes or no attestation. Remember, these are all things that you collected in your folder. If you did the preparation correctly, then you should be okay. If at any point that you think that you're going to need more time or you have questions, do not hesitate to contact the Figliozzi & Company. From my own experience, they've been extremely accommodating and helpful whenever we've needed more time. So this concludes the brief MU portion of the webinar. If you'd like to access these slides in order to reference links and the material, there will be an email address at the end of this webinar where you can request a copy of the slides. LSQIN does plan to post all webinar materials on their website. However, it's still under construction and should be up here pretty soon, though. Thank you, everyone. And I will be at the end of this webinar to answer any of the questions, as well as Minnesota and Wisconsin regarding meaningful use. So thank you again, and here is Laura Sawyer with her presentation on PQRS.
Thank you. Excuse me. Thank you, Tisha. So now we're going to discuss how to report PQRS physician quality reporting system using your EHR system. If you are choosing to report PQRS measures using your EHR, you must be on a 2014 certified EHR technology. To verify this, you can use the Chapel website that Tisha did reference earlier in her presentation. It's the same website that you get the certification ID, and you can search for either your vendor or your product name to verify that they are 2014 certified products. Once you have verified that it is 2014 certified, your vendor will either be a data submission vendor or a direct vendor. And the difference here is whether or not the vendor will submit on your behalf or whether or not you are responsible for submitting your PQRS data. So if your vendor is a data submission vendor, then you will tell your vendor what PQRS measures you want to report, and they will pull that measured data from your EHR system and then submit that data to CMS on your behalf. On the other side, if your vendor is a direct vendor, then you are responsible for submitting your PQRS data. And this is done by generating a file called Quality Reporting Documentation Architecture, which is referred to as a QRDA report. The QRDA file collects the PQRS measure data from your EHR in a format that can then be uploaded into CMS's QualityNet portal to be analyzed, which we will discuss on the next slide. So access to the QualityNet portal where you upload your PQRS data is given to those that have an IACS account. You must establish an IACS account to have access to QualityNet. And what IACS does is that it provides physicians and other healthcare professionals a way to access different CMS applications, including PQRS. For the PQRS program, you can submit your PQRS data by submitting the QRDA file into QualityNet. You can also view your PQRS feedback reports, and these are reports given to individual eligible professionals to tell them how they performed in the PQRS program. And you can also use QualityNet to view the quality and resource use reports, the QRURs, which are new to groups of 100 or more, and those tell those groups how they did in the value-based modifier program. You can also use your IACS account to log into QualityNet and register to report PQRS as a group. The deadline to do this for 2014 reporting has passed, so if you did not register to report as a group, then you must report PQRS as individual providers this year. So there are different roles in QualityNet that you have to apply for using IACS. The first role is the security official role. This is the first person that registers, and they also register the organization using the tax ID. Once the security official is approved by CMS, they're almost like the owner of the account for that organization, and anybody that applies for a role tied to that account, they have to be approved by the security official. The security official can also delete any roles and maintain all roles within the organization. However, this person does not have access to actually submit any data or retrieve any reports. So there has to be another person that applies for these roles using IACS. So the next role for your PQRS submission is the actual PQRS submitter. This person will apply for an IACS or apply for the role of the PQRS submitter, and they have to be approved by the security official. Once they are approved, they are able to upload the PQRS data, which is the QRDA report, into QualityNet. They also have the ability to tell whether or not that PQRS file was uploaded correctly or if it failed. The last role for PQRS submission is the end user. Again, once they register, they have to be approved by the security official, and their role is to view the feedback reports in QualityNet. The end user is an optional role because if you do not have a third person to apply for this role, you can also call QualityNet and request the feedback reports, and they will send you those reports. Also to note, if you do have an IACS account, you have to keep your password, or have to update your password every 60 days. Otherwise, you will be locked out and you will have to re-register for an account. So the process of actually submitting your PQRS data, which is the QRDA report, to QualityNet is as follows. On your office computer, you will generate that QRDA file using your EHR and then save that file into a secure location on your computer. Next, the PQRS submitter will log in using their IACS credentials into QualityNet, and they'll actually upload that QRDA file. And then uploading that file is as simple as attaching a document to an email. They'll be able to browse the files on their computer. They'll select the QRDA file, and then they will be able to upload it. They will then receive a submission report that alerts them whether or not the file uploaded correctly. If it did not upload correctly, there will be an error code or a reason why that file didn't upload correctly. Oftentimes, patient data is missing from the QRDA file, which they would have to go into their EHR and correct that and then re-upload it. Or the QRDA may need to be updated by the vendor to a newer version, and then once that QRDA file is updated by the vendor, they would then again have to rerun that file and then upload it into QualityNet. So once it is uploaded correctly into QualityNet, CMS can analyze the PQRS data that's in the QRDA file and then determine if the eligible professional was successful at reporting PQRS. There are links here on the slide to register for those different IACS user roles. Again, you can request these slides to be sent to you and in the chat box. And then also at the end of today's presentation, we'll provide you the email to request these slides. Lastly, prior to PQRS submission, you are also able to test your system for errors using the submission engine validation tool. This can be accessed again through QualityNet using your IACS credentials. The submission engine validation tool tests your system for errors. Oftentimes, you will need to update your version of Internet Explorer or Adobe Reader. And if you do this prior to PQRS submission, you'll already have that in order when you come to actually submit your QRDA file. The submission engine validation tool also validates the format of data files for the PQRS submission. And again, to access this tool, you must have an IACS account to log into QualityNet. And then that concludes our slide on the actual PQRS submissions using your EHR system. Thank you, Laura. Just wanted to make a few more announcements. MPRO, Stratus Health, and Medistar are currently recruiting providers to participate in our quality initiatives. These initiatives cover the continuum of healthcare from ambulatory providers to home health agencies, hospitals to nursing homes, and also includes some community organizations. The LSQIN will be focusing on these initiatives for the next 5 years, and we would love to have you join us in improving the quality of healthcare for your Medicare beneficiaries or loved ones. If you are interested in receiving more information regarding these initiatives, please contact Christy Mims in Michigan, Jerry Kinnicker in Minnesota, or Marnie Anderson in Wisconsin. Alicia, you can now open the lines for questions.
And I just want to let you know that Candy Hansen did join us, so she is here on the line.
Okay,
ladies and gentlemen, if you would like to ask a question, please press the number 1 key. Again, if there are any questions or comments at this time, please press the number 1 key on your telephone. And our first question comes from Kelly Martin at OMH Medical Group. Please go ahead.
Hi. Question about submitting the QRDA. If we are testing as a GPRO, is that still what we submit?
If you registered to submit as using the group reporting option and then that you are using the EHR, you would submit the QRDA file unless your vendor is submitting on your behalf.
Okay. Thank you.
Yep.
And our next question comes from Nerdette Turan at the office of Dr. Turan. Please go ahead.
Hi, this is a question actually for Tisha. Hi, Tisha. How are you?
Hi, good. How are you?
Okay, thank you. I've been struggling this whole year just to get to meaningful use too with everything, and of course everything slipped out of my head. I have everything all set with all my measures, but I sat there going, oh no, PQRS. What do you suggest for me, seeing that I have eClinical Works and it's been a nightmare to deal with them, to do everything, because I did claims-based before. What is my next step to get this all on board? Because all my numbers are up to par.
Okay, so for PQRS?
Yes, I mean, I've been submitting, we do it on a claims-based basis all these years, and my numbers for that, for the whole everything stage 2, I'm all set, but I'm sitting there going, was I supposed to do this another way? So after this webinar, I'm like, oh no, I was supposed to do this another way. What do I do now?
So if you're going to do, I guess Laura's going to have to answer this one for you. Okay.
Okay.
If your question is regarding submitting the PQRS measures
right.
to the eClinical Work, so you can do it on claims.
I still can do it on claims.
Yes. The requirements for PQRS this year have gone up from last year. So last year you just had to report the 3 PQRS measures, and now that's gone up to 9 measures across 3 domains.
Right, which coincides with stage 2 for fiscal year.
Yes, the PQN. So, so there's also the option to report once. Is that what you're referring to? So if you're doing PQRS on claims, but then you can also, when you submit your ECQNs, you would select measures that count as the CQNs and then also the PQRS measures. And then rather than for this year, you only have to submit a quarter's worth of data for the PQRMs. But if you want to do the report once for the PQRS measures and then the CQMs, then you would have to report a year's worth of data and make sure they were measures that were for both. And those would be submitted during the PQRS reporting period. The only thing is, I know eClinical Work, they report either using the registry or they'll submit on your behalf. So the process of doing the report once kind of varies by vendor. So I would contact eClinical Work if you wanted to do that option, because I believe if that's what you wanted to do, then they would submit that on your behalf, and then they would have to create kind of like a workflow to collect that data for you.
Okay, but from
on, I have to probably, because they're getting away from claims-based. Am I correct?
Right. CMS is moving away from
Okay, so I'm okay for 2014. If I've been reporting all year long and I'm just doing it based on claims, I'm pretty much okay for PQRS. And I just need, that was my concern, because I went, oh my gosh. So I'm set for that, and then I've already done those 3 categories, whatever, for meaningful use too. Stage 2, those are things that I'm going to sit down and plug the numbers in when I sit there in a test. But for going forward, January of 2015, I have to then go through this whole, I'm confused, this whole IACS account, and I have to register for all that. Am I correct?
It's very vendor specific.
Okay, so I have to check with them.
If you have to upload it yourself, then yes, you need an IACS account. And those are helpful because you can get your feedback reports. And then even now, if you're reporting with your claim, you can log using your IACS account and then go into QualityNet. And then I think they give you kind of an idea of how you're doing with your claims reporting. So with clinical work, and then you can email me about that, and I can give you information about checking your progress with claims. But with eClinical work, I believe they submit on your behalf, so you wouldn't necessarily need an IACS account. But I still think it's still something that I think is beneficial to have.
Yes, I agree with you, because you can't trust the vendor.
Laura and I can do a separate call. Offline.
Sorry, that's fine.
You want me to do that?
Yeah, that would be fine. Thank you.
Okay, good.
Thank you for taking your time. Thank you.
Ladies and gentlemen, if there are any further questions or comments at this time, please press the number 1 key. Again, if there are any further questions or comments, please press the number 1 key on your telephone. And there are no more questions in queue.
Okay. I wanted to thank everyone again for joining the call and let you know about some of our upcoming webinars. On January 22nd, please join us for an educational session on stroke prevention and atrial fibrillation. Nursing and medical CEs will be available for this call. And on January 28th, please join us to learn how to participate in PQRS with the LS2IN. More information regarding registration for these webinars will be forthcoming. Don't forget to follow us on social media. The Lake Superior Quality Innovation Network is on Facebook and Twitter. And last but not least, we wanted to wish everyone out there happy holidays from all of us at the LS2IN. Thank you again for joining today's call. We hope everyone has a great afternoon, and if you could please fill out the evaluation before you disconnect. Thank you. Thanks, everyone.